Great. Hi, everyone. My name is Manan Cha, and I am the instructor for this inaugural course, Mental Health Advocacy. It's great to see so many students from the two sessions. I think I've called most of them. I see a few others. Aleph is there, Andrea, Arzu, Nicole, and Paige, and so on, Mackenzie, and that's fantastic. What I'm also very excited about is a lot of names that I don't know, which means that word has gotten out. And we have other students and colleagues from FTU's various health and science programs. So this, as Boyana said, is the first time we're doing this. We have a guest speaker for the mental health advocacy uh, course. We'll be having one uh, later on in the semester as well, which I'll tell you a bit more about. But for now, I am very excited to introduce our guest speaker. Dr. Zakia Clay is a licensed clinical social worker. She's also an assistant professor in FDU's own Master of Social Work program. Um, she has earned her master's and doctorate degrees in social work from Rutgers University. She also holds a certificate in clinical supervision, seminar and field instruction, and psychiatric rehabilitation. For much of her career, Zakia has worked in community mental health with adults living with mental illness. In this capacity, she worked within a variety of client systems to provide clinical support, case management, crisis intervention, and advocacy services. A few years ago in 2017, she was sought out by the New Jersey Division of Mental Health and Addiction Services to assist with the transition to fee for service. She is a practicing clinician. And as I mentioned, she's also an assistant professor here at FDU. The theme for this presentation is the role of the community as a mental health advocate. In this course, we're going through various members of the ecosystem and talking about the role that they play, starting with the individual as a mental health advocate, caregivers and families, the communities, and because this is in the policy track of the NPH program, all the way up to policymakers and legislators and the role that they play in advocating for mental health. So for this, Zakia will be talking for about 20-30 minutes. There's a few slides. After that, it's definitely open to questions, and we encourage definitely a robust dialogue and conversation. So please feel free to speak up. You can enter your questions in the chat as well. And with that, Dr. Clay, I'll turn it over to you. Thank you again for being with us this evening.
No, thank you very much for having me. Let me just, I couldn't resist. I know this is informal, but I had to get a few slides together just to get a little bit more structured and making sure I'm hitting all of the important points. So I really just want to jump right into this because the time is going to go fast. So I want to know from all of you, specifically, what comes to mind when you hear the words mental health? And so as you're thinking about that, what I just put in the chat is a website link. I'd like you to go there where it's going to prompt you to enter in those codes 718096. And I want us to really kind of look at this in real time and see what all of you are thinking as it relates to mental health. And so I'm going to pull that up actually. So again, you're going to go to menti.com, type in the code 718096. What words come to mind when you hear the words mental health? Mindfulness, okay. Important. Struggle. Relaxation. So one of the things I want to point out as the word cloud is continuing to go is that the words that are larger signify words that have been entered multiple times. So the larger the word, the more individuals that are kind of typing in, it's resonating with many of you. So undervalued, emotional well-being, struggle, everybody. Psychosis, I'm looking at some clinical terms coming in. Disease, stress. And so serious neurology, okay. Self-care, also very important. And I can't help but think about the times that we're in right now, right? With the pandemic and how much mental health is really coming to the forefront. And we're hopefully going to have time to circle back to that in a bit. But I do thank all of you for participating in that. So there's a lot of commonalities in terms of what comes to mind. And so for me, I like to conceptualize mental health as emotional well-being. And I think I saw that there on the word cloud. And I think, I like to think anyway, that we all strive for some sort of emotional balance, whether that's through daily practices, routines, habits that we have, connections that we make. However, I think we would all agree that it's not always possible, right? A life event can occur, a diagnosis for some people, even environmental circumstances can really result in distress that can really just throw off that emotional balance that we all try to maintain. And for me as a social worker who spent much of her career working in community mental health, I was charged very much with helping people to maintain or find that emotional balance that I'm talking about, and working towards really recovery. And by recovery, I mean recovery as it's defined by the person, right? Not defined by me as the social worker, but really trying to tap into and understand for that person, what does recovery mean to you? Even really asking them, what does mental health mean to you, for you? At the time, during my community work, I worked with adults living with serious mental illnesses. So diagnoses like schizophrenia, like bipolar, like depression. And just to give some context, there was a time where people would be hospitalized for long periods of time. And I'm talking post deinstitutionalization. So there were people that were still being housed in hospitals, not because they were unstable, but really because they had no place to go. And that was really unfortunate. But luckily, there was a landmark case. I'm not sure if those of you are familiar, you might be, Olmsted versus LC. And that was in '99, and it started actually in Georgia. And that case really, the Supreme Court found that the segregation of people with psychiatric disabilities, right, for reasons such as they just don't have anywhere to go, so we're just going to house them here in the hospital, violates or was a violation of the Americans with Disabilities Act. So that was really significant. And since then, it branched out. So it went beyond Georgia, and New Jersey, the state of New Jersey got sued for doing the very same thing. And what happened was patients really then had the opportunity to be discharged. Funding streams started to happen and programs were developed. And I was lucky enough to have the opportunity to work for an agency that was doing just that. And so that really was the beginning of my time in community mental health, when following Olmsted, where I was doing assessments and monitoring for people who were discharged from state psychiatric facilities, helping them with skills building and crisis intervention, case management, linkage and referral. It goes on. But a big part of that too, as a community mental health worker, was advocacy. So I don't know, any of you from New Jersey, you might notice, anybody recognize any of these hospitals? I'm only on a small, hold on, let me make my view bigger so I could see some of you. Anybody recognize those hospitals? I see some heads nodding. So those are the pictures of the 3 state hospitals actually in New Jersey. So this is Greystone, this is Trenton State Psychiatric Hospital, and this is Ancora. So those are still state hospitals that exist. They're a little bit newer now, but if you Google online, you can see what they used to look like. It's just interesting to see their evolution. But the good thing is, for me, I feel like Olmsted, that whole lawsuit was really a result of advocacy, if you think about it, right? Advocacy that started on an individual level, but then really got to more of a macro level, right? It was really grassroots, and then really had implications to many community mental health programs. So the agency that I worked for really embraced a recovery and rehabilitative philosophy. And what I mean by that is really focusing on community integration, quality of life, and recovery. And we did those things by really trying to offer those array of services that I went through just a few minutes ago. But really, we strive to also empower people to advocate and do for themselves. And that was a crucial part of our work, because oftentimes when individuals had lengthy hospitalizations, they were not used to exercising those skills, right, of advocacy. In the hospital, often people are doing things for you. You're not having the opportunity to, you know, dictate when you take a shower, when you eat, take medication, right? And so over long periods of time, individuals aren't as used to, again, speaking up. And so that's where the community mental health programs came in and really would help individuals to kind of learn to exercise those skills once again. So we're talking very much about advocacy, right? That's the theme of the evening. So I want to ask you, any of you, how do you define advocacy? And feel free to either type it in the chat or take yourself off mute. How would you define advocacy? Especially those of you in the advocacy class. What do you think? That's the theme.
I can call on you. I have no problem doing it.
What do
Anyone
you
want to
think?
take a speaking up for rights? Yeah. Anyone else?
Any thoughts? And it doesn't have to be a textbook definition, right? Just any thoughts on advocacy.
There's some great ones coming in the chat. Again.
Oh, would you mind reading a few of them?
Equal access to mental health services, speaking up for rights, speaking up for people who may not have the power to do it themselves, support for our cause. The definition depends on the setting. I believe it has to do with speaking for those who can't speak up for themselves and drawing legislative attention to issues, support for a particular policy, a lot about being a voice for others or for those who can't speak up for themselves.
Absolutely. And thank you for those of you who contributed in the chat. And thanks, Professor Shaw, for reading those out. So hold on here. Let me Go to the next. So MPH students and maybe others are familiar with the definition through coursework. I think it's a good one. So I reference it often and thought it would be helpful to just spend a bit of time on it. So the World Health Organization notes that advocacy is an important means of raising awareness on mental health issues, ensuring mental health is on the national agenda of governments, and really can lead to improvements in policy, legislation, and service development. So I really like the definitions that were contributed in the chat because I think in many ways are really speaking to this robust definition here through the World Health Organization. So my time in community mental health, I wanted to spend some time talking about like what did that look like from a community worker's perspective in terms of advocacy? What were some examples of advocacy efforts that I would engage in? And so there were times where individuals that were receiving services through our agency had emergencies, right? Psychiatric emergencies. And we needed to call emergency response teams to lend extra support. And law enforcement officers, for example, would be a part of that response team. I found very often that those were wonderful opportunities to engage law enforcement officers, to educate them about mental health, perhaps even modeling de-escalation and at times humane treatment for individuals living with mental illness who were in a crisis. A lot of law enforcement officers, unfortunately, aren't trained to respond to mental health emergencies. And so that was really a great opportunity to kind of educate the community. So what do you think about that particular example? If I stopped there, I'm curious and I'm wondering if you have any ideas on other ways to engage in mental health advocacy with law enforcement as an example. And again, feel free to um, make some notes in the chat or take yourself off of mute. So other ideas of ways to engage in mental health advocacy with law enforcement. And I'll give a minute or two for those of you who are typing in. And just be sure when you're in the chat, I'm so sorry, just wanted to make a quick note in the chat. Also make sure you're putting it for everyone if you want others to also engage in the conversation as well. Go ahead. There was somebody that had a thought. Okay. Well, I'll jump to Julie. So Julie, thank you for your comment. You said, I think the issue isn't clear cut, sadly. Individuals going through psychiatric crises may pose a danger to themselves or others. How would police officers be able to tell? So that's the question, right? If we're thinking about advocacy, what are some ways that we could advocate perhaps for those living with mental illness on that level? Police officers training units to respond to mental health crises. Excellent. Any other thoughts? So I like the idea of the training, and I think here in New Jersey anyway, there are trainings that are taking place. And I think that, again, this is a perfect illustration of advocacy that really started within the community in response to things like, inhumane treatment or not enough education about how to respond in terms of a mental health crisis. And so in New Jersey, it's CIT, Crisis Intervention Training, and it really is a model, an international police model actually, that incorporates a collaboration between mental health systems and law enforcement. and teaches them how to respond in terms of a crisis situation. And so there's certifications that law enforcement officers can receive. I believe it's something like 40 hours of training or so they have to do, and really learning crisis resolution skills. And so again, a wonderful example of advocacy efforts that have fruitful results. So social workers as a part of the response team to assess the situation, that's another great example. And having specialists present in mental health crisis along with police officers. And really, a lot of the models are speaking to that, and you're seeing that happen more and more. Again, I think my belief is that all started with advocacy efforts. Any questions so far as we're moving right along? Hard to believe it's already 7:23. Just want to pause a minute for questions. Again, feel free to take yourself off mute. I'll check the chat as well. Okay, not seeing anything. We're going to move right along. So some other opportunities for advocacy when I was doing direct practice work was really with healthcare professionals. And so some examples of that, I found myself working very closely with prescribers, so psychiatrists, APNs, and really helping speak about changes towards medication. And really, many psychiatric medications, many of you know, probably have a lot of challenging side effects at times. It can be weight gain. It could make people really tired, making it really hard to get up, early if they have to go to work. Sexual dysfunction, and a lot of the individuals that I worked with would confide in me about how the side effects were really negatively impacting their life, but they really were not comfortable advocating on their own behalf. They didn't feel confident when they went to appointments. They didn't feel they would be heard. And so, why do you think individuals with a mental health diagnosis, in some instances, lack that confidence to advocate for themselves? So, we'll pause here. Feel free to answer in the chat or if you have a thought about it. So sometimes healthcare providers can use language. Hold on. Can use language where the patient feels like he or she is being judged. Absolutely. Low self-esteem associated with stigma. People talk negatively. Absolutely. Judgments. Fear. Embarrassment. Yeah, right. And so the common theme that I'm hearing is stigma. And so it's huge, right? I've had firsthand experiences where some healthcare professionals would really be dismissive, unfortunately, of the patient or client or the individual that I was working with, of their concerns. They didn't feel as though the person was knowledgeable. I can recall accompanying folks to doctor's appointments or being in multidisciplinary team meetings where the patient or the client was also present, and the healthcare providers would direct all the questions at me. And so to me, that's very telling, right? Just imagine how awkward that is, right? You're accompanying somebody there for their health concerns, yet the healthcare professional is talking to the other person, right? Imagine what that person feels like. And so I think it speaks to what's being discussed here in the chat. So absolutely, I definitely agree with you. And so in those moments, those were rich opportunities for advocacy again. So educating healthcare professionals, advocating by redirecting them to speak to the individual that I was with, right? And there's ways to do that very tactfully, modeling that, right? So if they would start directing questions at me, I might say, hey, so and so, what is your thought on that? Or, can you respond? And really trying to again, model for healthcare professionals how to be person-centered and respectful of individuals living with a diagnosis. And really, I can't say enough how much of my advocacy efforts also were rooted in education, um, because a lot of people have a lot of misconceptions, right, about mental health. Whether they get that from the media, they get that from um, beliefs or values that may have been held from family, and sometimes it's about challenging or educating individuals, and kind of doing some myth busting, so to speak. So after community mental health, I transitioned, to becoming a full-time faculty member. And in all honesty, I didn't think I would be given the same opportunities to advocate in the same ways that I did when I worked directly in the field. And I was wrong, actually. Soon after I started in higher education, I began consulting with the New Jersey Division of Mental Health and Addiction Services. As was mentioned, in that capacity, I was helping them work to implement a new payment infrastructure into community mental health programs, specifically fee for service. And so it was interesting to be on the other side, right? I worked in community mental health for so long. I was on the front lines, working directly with individuals, working with families, working with the larger system, and now being pulled into higher education. I was then working on a systemic level for those programs that I was once a part of. And while it was unexpected, it was very valuable, that experience, in that I had the opportunity to advocate on that level. Um, so in particular, I advocated for the state to really integrate more rehabilitative, more psychiatric rehabilitative services into their payment infrastructure. And you might say to yourself, well, how the heck did you do that? Like what did that actually look like concretely? And so my efforts would take place during meetings, right? So I would tell my story and my experience from being on the front lines and speaking to how their decisions on that policy level, right, on that implementation level, considerations they should have, because it impacts individuals doing direct practice, right? And so I would speak to that experience that I had, because sometimes policymakers are a bit removed and may not consider certain things. And so really giving a voice to practitioners doing the work during meetings and other opportunities was really, really helpful for me. I would also do presentations.
Somebody that is.
Oh, is that a question, or was that somebody just coming off of mute accidentally, I think? Okay. I would also do presentations and trainings. And that gave me an opportunity to educate policymakers and other stakeholders. And that was really eye-opening, I think, for some policymakers and stakeholders, right? They weren't fully aware of what psychiatric rehabilitation meant. They really didn't understand what it meant to practice in a way that spoke to recovery, that spoke to community integration, that spoke to advocacy, right? And reimbursing for things like advocacy. Those were all things that I was advocating for on that level. And lastly, I raised awareness through publication. And so my goal in those efforts were to really connect with people in New Jersey, on the East Coast, but then beyond, right? Because likely there were many other states that were considering other similar payment restructures. And so really writing about that and going around and doing presentations through different organizations were definitely ways in which I was able to advocate on more of a systemic level. So how can you begin to mobilize? What might that look like? So educating yourself about mental health is key. Um, there's so much out there. There's so many great resources out there that I'll share in a minute. But educating yourself first, I think, is the first step, right? Because in order to educate others, you need to know what you're talking about, right? And educating others. So whether that's family members, whether that's community members, as I was giving some examples, joining organizations, that's a huge one. So I'm a part of the social work professional organization. So I get frequent alerts when there are policies or bills up for consideration. And so really also learning about your lawmakers. Who are the constituents in your area? What types of bills are they endorsing? Learning about the legislative process as well. And getting engaged after you learn about that process is also something that's a way to start to get involved. And just to circle back to organizations, even FDU organizations, student organizations, that's another great way to begin mobilizing and advocating and educating those around you. So I'm going to pause here for a minute. Any questions or thoughts about advocacy on the community level? Yes, no? Okay, so this is what we are going to do. Oh, is that a question? No? Okay, so what are some steps? I want you to take a minute to think about what are some steps you can take towards mental health advocacy as it relates to COVID-19, right? I kind of started off the conversation talking about how COVID-19 or the pandemic has really put mental health advocacy right kind of smack dab in the forefront, right, as I mentioned. And so we can't ignore the impact that it's having on mental health. And so I'm curious, based on our discussion, perhaps based on your coursework, based on your own experiences, what are some steps that you can take towards mental health advocacy? And since the theme is really as it relates to community, um, how can you take steps on a community level? Any thoughts? And again, feel free to write in the chat or unmute yourself. What are some steps you can take towards mental health advocacy as it relates to COVID-19? And I want to challenge you to think not on an individual level, but more community level. Learn about the effects the pandemic has had on mental health of individuals through studies, and publish a new study that focuses on anything that was missed in previous studies. Aisha, excellent. This is, prime time for collecting data and sharing with the larger community, destigmatizing people who catch coronavirus. Tell me a little bit more about that, what you mean, Michael. While we're waiting for you to expand a bit more, Julie, highlight the importance of mental health in the setting of your employment or education. Advocate for access to mental health resources through your employer, if those resources are available. Absolutely, we often don't know what's available on that level. And so educating yourself about that and figuring out what the gaps are. And if there are gaps, getting together, maybe using student organizations to try to advocate for resources for the larger university community in this example. Sophia, reaching out and checking up on neighbors, friends, and family. Okay, thank you. Kolshan is saying something similar. Okay, increase resources. Bear with me, I'm trying to read all of these here. Which one was I on here? So increase resources. Hold on. And support groups. Absolutely. Support groups are huge and can really be helpful. And thinking a lot now about so many support groups that have gone virtual. And not everybody knows about the support groups now. They're actually pretty accessible in terms of availability of time. And so really letting people know about what's being offered to help those during the pandemic. The COVID-19 helpline, which is already in place. There's so many of these. I really appreciate all the comments in here and ideas. Have mental health days. So this is from Erica, having mental health days at workplaces and encourage those who are on the front lines, especially to take a break themselves, right? And so those are advocacy efforts that may need to take place within your community workplace, right? If that's not something that exists. You know, whether that's advocacy to administrators, HR, and really, you know, speaking to the impact that you're having on the front line. As I mentioned earlier, when I worked or consulted with the state mental health authority, they weren't always aware of the nuances that were experienced for frontline workers. And so I really appreciate that thought there, Erica. So Nicole is bringing up, I love how some content from your coursework is coming back in. So last week, Nicole is saying there was a discussion about identifying mental health issues, specifically in healthcare workers. So use research to identify what is happening the most in this setting through data and identifying interventions and resources. Excellent. Paige. Talking about the difficulty, especially within communities, so checking on friends and family. So a lot of commonalities here in some of what is mentioned, and I absolutely appreciate all of the comments here. So another one here from Visha. Move away from the mentality that someone who had COVID is bad and educate others about how it can take a real toll on a person's mental health. That's really great, right? So thinking about education and ways in which you can educate, you could get really innovative. One of the things that I did when I consulted for the State Mental Health Authority was I built this website that some community providers were using. And it was really about the recovery philosophy and how to put that into practice and really help them in terms of payment infrastructure and thinking about how they could practice in a way that was in line with the expectations from the payers, but also stay true to rehabilitative and recovery-oriented services. So education through technology, I think, is kind of the wave of what we're going towards, but also, you know, giving consideration to those who may not have access, right? So thinking about multidimensional ways or a multitude of ways to disseminate information. Thank you very much for that. So some resources here that I did want to share with all of you. I wasn't always aware of it. Some of you may be aware, maybe most of you are aware, but 211 is something that many of the providers had shared with me when I would do trainings quite often and said you could find almost anything by dialing 211, but they also have a dedicated section on their website to mental health resources, right? Resources are going to be significant in your community advocacy efforts, right? Because you need to be educated yourself. And so this is a great tool to one, educate yourself, but they also have great handouts that you could print out and share, right, with individuals, family members, community members. NAMI, a little plug for NAMI, I think, which is very timely since there's going to be another presentation in a few weeks or so from someone from NAMI, to my understanding. And that really, this website here really kind of lays out a nice framework for advocacy and speaks to ways that you can mobilize. The National Institute of Mental Health. And then finally, which many of us don't think about, and I'll raise my hand, myself included, I always have to remind myself, track legislative information and stats, right? So this website, govtrack.us, you can really find a lot of information out about what is pending in your area, learning about your lawmakers, your policymakers, and really, again, trying to set up meetings with them, right? Really getting in there and getting involved. And so I guess I just want to kind of wrap up before we open it up to more general questions by saying, while I'm a social worker, and most of us social workers consider ourselves agents for change, I believe that we all can be agents for change, not just social workers, but public health, pharmacy, all disciplines, because really, we are working all towards the same thing, right? Is for the individuals that we're serving. And so I think advocacy can be demonstrated in small ways, as was mentioned in some of the examples, educating a friend, community, neighborhoods, and you can get involved, right? Locally through joining organizations, professional organizations, FDU, student organizations, and educating yourself, right, about policies, as I mentioned. And I just want to thank not only Professor Shaw, but the MPH program, Dr. Stojcik, for coordinating the lecture on mental health and really for inviting me to speak because as some folks mentioned in the chat, right, mental health is not always something that's talked about a lot. And I want to extend my thanks and appreciation to all of you who joined at 7 o'clock on a weeknight, and just recognizing the capacity. I just want to stress recognizing the capacity that we all have to be advocates in some way, and it's worthwhile and of value. And I hope that you were able to take that away from our short time together.
Thank you, Dr. Clay. This was a fantastic presentation. I think as the audience thinks about questions I'd like to ask from a resource perspective, there's one more that I would like to add. I think the ability to talk to someone and have someone just listen to what you're going through it is just so important. And I've been a crisis text counselor myself for the last 3 years. So crisis text is something I'd recommend for anyone needing to go from a hot moment to cool down, to talk to someone free of charge via text. You can text 741-741 on your phone and you'll be able to talk to someone within minutes. I encourage it for anyone, or if you need a resource for a friend or family member, someone you know who may be going through a hard time, a great resource for them as well. But again, thank you, Dr. Clay. This was fantastic. I do want to open it up to questions. I know the students in mental health advocacy are definitely not a shy lot. So while it's great to see the use of the chat, I also encourage you to come off mute and ask questions as well. Perhaps I can ask one in the meantime to you, Dr. Clay. One thing I've noticed of late is the increase of the celebrity as a mental health advocate, and we've seen from Prince Harry, excuse me, Chrissy Teigen, Kevin Love in the NBA, all of them speaking up and saying almost as if I can deal with it, it's okay to talk about it, it's okay to speak up about it. I'm curious your take on that. I mean, does that help alleviate the stigma around mental health? Do you see that as a important part of advocacy when it comes to dealing with mental health and issues associated with that? Just welcome any thoughts you may have there.
I think that's such a great question. And I think that one of the things that we kind of touched on very briefly when we were talking about stigma is that many times we get our impressions about things through the media, right? And through TV. And, the reality is that celebrities really are very influential when they come out and speak on things. And so I think it's wonderful that you have celebrities that are so influential speaking out. I think it contributes to normalizing mental health and kind of stepping away, so to speak, from the idea of mental health being the other, and oh, that's not me, right? That's kind of a taboo topic. I think in many ways, the celebrities are modeling that it's okay to speak about mental health, that mental health is important. And so I really applaud people who come out and speak about it.
Great. If it's okay, I'll read you some of the questions from the chat. Julie stated, "Thank you for your lecture, Dr. Clay. What resources are available for assisting family members of patients with mental health illness to recognize the need to get professional help?"
That's a great question, Julie. And NAMI, which was on the slides, the link that I provided was specific to advocacy, but NAMI has some wonderful support groups. And what's really nice about NAMI support groups is that they have support groups for individuals living with a mental health diagnosis, but also for family members. There's great resources that are also specific to culture. And so you can go into NAMI's website and really just kind of, it probably wouldn't take too much time at all to find specific self-help groups for family members because that is a huge need, right? Creating opportunities for family members to connect with one another, finding that universality, right? That, hey, I'm not alone. My family, I'm not the only family that's dealing with this, I think can be so meaningful for family members. So great question. So NAMI.
Great. And Aleph, I'm sorry I took your question, but I'm glad to see you have another one. Generally, about the role of social media influencers on mental health advocacy, can you foresee any negative effects of this?
Yeah, there's always sometimes, or can be, a double-edged sword, so to speak, with these things. The one thing, I mean, I think it goes to media influencers, but I think as social workers, I take responsibility for this and I'm very, very careful. And I think as healthcare professionals, it's something for you all to consider as well, is the language that we use. And so it can be very easy because I still practice now, as was mentioned, and I frequently see folks come in and they'll use kind of these clinical terms, very like easy, right? Like, oh, I'm anxious, or I'm schizophrenic, or and they'll kind of use these terms out of the DSM clinical diagnoses, or they'll Google all this stuff, or they'll hear influencers speak in this way. And I think I always like to uh, take it a step further and investigate and have a natural curiosity. And yeah, I'm OCD. Yeah, so you hear things like this quite a lot. I try to model with the individuals that I work with that you're a person first. And so if someone says to me, well, I'm just so OCD, I'll pause and say, tell me more about that. What do you mean by that? Give me some concrete behaviors. And I'll explain why I not that I don't want to use those terms, but I feel like I'm almost contributing to individuals using those terms in a way that can be viewed with negative connotations, if that makes any sense. And so I, again, try to model person first language and, and very mindful of the influencers in terms of, educating patients about terms that are used and how it can be viewed as derogatory, right? Or contribute to stigma that's so prevalent in mental health. But great question.
I just wanted to kind of add to that. I also think sometimes the overuse of these terms almost undermines the true effect that those conditions have in people's lives. Someone suffering from depression or OCD, how difficult it is, the struggle to live with that on a day-to-day basis. And then for people who don't necessarily have those diseases, but to throw those words around almost kind of simplifies it for the people that are actually suffering from it. And I think that could be dangerous.
Yeah. Very dangerous for sure. Right. Because I've seen, patients or clients or individuals adopt that language, right? And then internalize it and almost, you know, it becomes a barrier towards recovery, right? I can't do this. It becomes a limitation, right?
Mhm.
I can't engage in this because I'm bipolar, or I can't do this because they say this, or, I'm manic right now. And so really, again, being very mindful of the words that we use when we're speaking with individuals, I think is a key component, really, if you think about it, related to advocacy in many ways.
I agree. Thank you.
No problem.
Um, Paige asks, are there key characteristic traits that you have identified as an advocate? For example, maybe patients with physicians as well as law enforcement officers. Thank you.
So characteristics in terms of the person being the advocate, just a clarifying question, Paige.
Yeah, as being an advocate.
I really think in order to be and anybody could really be an advocate. I think having a genuine care and concern, right, and an interest in wanting to see improvements, right, in wanting to help others. That as so many great so many colleagues or peers of yours has put up in some of their definitions of advocacy, right? Like helping others who may not have a voice. So having a genuineness about wanting to do that work, patience, determination for sure, because when you're talking about systemic or community, like these larger scale changes, that you want to see happen, it doesn't happen overnight, right? So I also want to be honest in my journey in terms of these things weren't always so easy, right? I don't want to give you falsehoods here that, hey, yeah, every time I talked to a law enforcement officer or every time I was at those meetings, at the state mental health authority, everyone was like, oh, yes, great. And it was a kumbaya moment. That's not the case, right? You have to, in many ways, be determined and persistent in your message, in your education, and really not give up, because it may not happen the first time, right? Change may not happen. It may not happen the second time or the third time. And that's where I think the community organization and community advocacy efforts become so much more powerful, right? Because then you're joining your voice with other voices that really have a similar aim or charge. And I think that can speak volumes and really get the attention of larger stakeholders. But great question, Paige. Thank you.
Thanks, Paige. I think we have time for one more question. If anyone has any final question they'd like to ask Dr. Clay, either on the chat or just come off mute.
As we are waiting for that final question, I'm not trying to deter anybody from asking a question, but if it's okay, I would like to also pop in the chat there an anonymous survey, because I think it's important for me, as someone who comes into these classes or is just facilitating courses to just get some feedback about what your experience was, if you got what you got from the lecture today, and any comments or thoughts that you may have. It's a very quick survey. It's anonymous. So if you can, that would be great. And I'll also share the link with Professor Shah if he wants to disseminate that via email as well.
Sure. And yes, please, I encourage everyone to fill out the survey. That would be greatly appreciated. Again, Dr. Clay, thank you so much for your time. I think this was a fantastic presentation. I'm very happy to see the engagement from all the audience members. I think it just reflects the importance of talking about this topic, and it's something that we'll definitely continue doing throughout the semester. On March 18th, as a great connection to this, we'll be having our second guest lecturer for the class. Andrew Sperling is Director of Legislative Affairs at NAMI, the National Alliance on Mental Illness. He's been in that role for 25 years now, and I've been fortunate to know him for a few years. He's going to be talking about the role of the policymaker as both an advocate and someone to advocate to. So he'll be sharing insights on his time on Capitol Hill, the evolution of advocacy related to mental illness, because it definitely hasn't been as open and free to talk about as it is now. So he'll be sharing some insights there. And then again, how to engage policymakers as an individual and as an advocate yourself. Again, that'll be on Thursday, March 18th at 7 p.m. More information will, of course, come ahead of that. We had a great turnout tonight with almost, I think it's peak 56 people joined, which is amazing. So we'll hope to have strong numbers later on. Before I wrap up, I think, Boyana, I'd like to turn it over to you if there's any final comments you have.
Yes, I just wanted to thank you, Zakia, again, and Manan, to you for organizing this great session. And I would like to go back. I didn't want to interrupt any of the presentation or make any comments, but I like that moment when you mentioned that, yes, you as a social worker are doing advocacy, but one of our public health major competencies and roles is really advocating for individuals and issues and so on. So I think this is a great, again, great intersection in our School of Pharmacy and Health Sciences, where we all sort of are doing and professionally engaging in advocating for some issues, whether it is mental health or any other health issue, or any policy on any of the health issues. So I think this is, I agree, this is such a great, great moment, and I hope it's just the beginning of our series in, I would say, probably we should find a common thread such as advocacy and try to work together to provide more sessions. I'm really pleased to see so many of our students being here tonight, and I thank you both, and thank you everyone.
Thank you.
Great, everyone. Then thank you so much. This concludes the presentation, the lecture for tonight. Hope you have a great evening and hope to see you soon. Take care, everyone.
Thank you. Look at that, 8 o'clock on the dot.
On the dot. Fantastic. I like it. Thanks again, Zakia. Talk